So for this video, I'm going to be demonstrating how to document INOs, administering medication through an NG tube and a sub-Q injection, and then also doing a continuous feeding. So I'm going to do my hand hygiene, and I'm going to look at my MAR here. So my patient is Joanne Jones. She's allergic to penicillin. Her physician is Jeff Moberg. Her date of birth is 12/3/67. And the date today is 10/19, and we are doing her 8 a.m. meds. So it looks like she's going to be getting a few different medications, but we're just going to start off with first doing her Jevity, which is her continuous feeding, and her Lovenox 40 milligram sub-Q injection. So I'm just going to get her injection here first. So go into her drawer. They usually come packaged like this, but for the video I'm going to be using our demo one because we cannot put anything into poor Joanne. So just making sure that I have the correct medication, checking my Lovenox 40 milligrams, and then that looks good. So I'm just going to put that into my basket, and then my Jevity, which I'll have here, 40 milliliters an hour, and these are both given at 8 a.m. So that was my first check. And then I'll also just describe how to do intake and outtake as well. So we use these little pads here. So you'd want to make sure you put Joanne's name at the top, her room number, her date. So the shift that I would mark on is my 7 a.m. to 7 p.m. So anything oral that she takes in, so rather she's drinking through her NG tube, anything liquid that she's taking in, you would mark here. Urine output, you'd want to keep track of that, and then also any puke, diarrhea, or anything else that is a liquid that's coming out of her, you would want to document as well. And you can write your diet on here and everything as well. And this is just kept track in milliliters. So we keep track of these just so we can document it and everything like that. Okay, so now I have all this ready to go. I have my Lovenox, and now I'm just gonna go ahead and go to Joanne's room. So I'm just gonna move over here. Knock, knock, Joanne.
Hi.
My name's McKenna, and I'm your student nurse today, okay? And we're just gonna be setting up your continuous feed and giving you your Lovenox injection, okay?
Perfect.
Okay, so I'm gonna do my hand hygiene and put on my gloves. Okay, Joanne, could you confirm your name and date of birth for me?
Joanne Jones, 12/3/1967.
Perfect. And what are you allergic to, Joanne?
Penicillin.
Okay. And then I would have done my second check with my Lovenox injection too, right outside the door, just making sure once again that I have the right medication. And then now that I'm here, Joanne, on a scale from 0 to 10, 0 being no pain, 10 being the worst pain, what would you rate your pain right now?
0. I have no pain.
Okay, perfect. Is it okay if we go ahead and do your injection first?
Yeah, let's do it.
Okay, perfect. And then is it okay if we give it to you in your tummy?
Yes, please.
Great. So I'm just going to take my alcohol swab here and then just swab off her stomach. This is a sub-Q injection. And then, once again, I'm going to do my third check now. So I have my Lovenox here, making sure I have the right amount, 40 milligrams. Joanne Jones is my patient, date of birth, 12/3/67. And then Jeff Moberg is her doctor that prescribed it. It's 10/19, and it's her 8 a.m. medication. Okay, Joanne, we're just going to pinch your skin here, and it'll just be a little poke, okay? Okay. There you go. And then I would just get rid of this into the sharps container. And then now we're going to set up for continuous feed. So first, I'm just going to go ahead, take my truck here. Okay. I'm going to check here again on my order, do my second check. So yes, she needs Jevity, 1.5 calories for 40 mils an hour with her continuous feeding. So first, before you do that, we just want to check for stomach residual. Make sure she doesn't have more than 250. If she were to have more than 250, we would wait an hour, check again. If it was still more than that, then we'd want to notify the provider. So I'm just going to undo her tube here. Okay, so Joanne only has 35, so we're good to go. So I'm just going to go ahead and push that back in. Okay, close off the end. Okay, and then I would put my Jevity into my bag here. Make sure I had my 40 milliliters in here, just like Dr. Jeff has prescribed. And then your tubing, it kind of hooks up like an IV would. So you'd set your tubing in, program it to your 40 milliliters an hour, and then you want to prime your tubing. So you'd hit prime, it would prime through to the end of your tubing here. And then after it has been primed, then you would be able to hook it to Joanne. So you would just unhook this, hook your feeding up to Miss Joanne here. And then you would just press start to make sure that, you know, it was set to your 40 mils an hour like Jeff had prescribed, and then you're good to go and you can hit start. And then the other thing too is you would want to check every 4 hours for her residual, and then document this. So you would want to make sure you go to your documentation and mark off that you gave her Hergevity and her Lovenox. And then at the end of your shift as well, you want to mark your bag with your initial and everything so that the next shift knew where your medication was left off, or your feed was left off. And then I'm just gonna go ahead, do my hand hygiene, take off my gloves. Okay, Joanne, I'm gonna be back here in just 30 minutes to check on you, okay? And that's it. So then I can leave Joanne's room, take off my gloves, do my hand hygiene, and then I'll come back into my bedroom here. Okay, so like I said, then you'd want to do your documentation. This would be into your sharps, or you can set it to the side. And then now I'm going to be mixing her medications. And because we can't put any liquid into Joanne, we're going to be doing it into these for video purposes. So I would do my hand hygiene again, get off my gloves here. Okay. I'm just going to flip my table around. Okay, so I'm in my med room here, and that's just where I'm going to get my medications ready. So it looks like Joanne Jones, my patient, 12367, Jeff's her physician, and she's going to be getting 3 different medications that we are going to crush and give through her NG tube. So we have aspirin, 81 milligrams at 8 a.m. We have acetaminophen, 500 milligrams at 8 a.m. And we have Lasix, 20 milligrams at 8 a.m. as well. So we're going to get those out here at her drawer. So this is our Lasix, and that is 20 milligrams, which matches our medication there, 20 milligrams. Acetaminophen, 500 milligrams, 500 milligrams, so that's what we have here. And then we also have aspirin, which is 81 milligrams, which matches the bag I have here. So those are my 3 medications that Joanne's gonna get. And we're just gonna go ahead and crush them to start. So I'd wanna label each one of my cups so I didn't mix up any of my medications. So the first one is my aspirin. I'll put it into my cup. This is my acetaminophen. Just gonna set it in my cup. And then my other tablet, my Lasix. Okay. Then I'm just going to go ahead and check again just to make sure that I have the right medication. So my Lasix, 20 milligrams, acetaminophen, 500 milligrams, and my aspirin, 81 milligrams. So I'm going to put these back into my drawer. Each one of my cups, like I said, would be labeled. So this one here is my capsule. So we're just going to go ahead and open this one. Garbage. So you have that one here. And then on each one of these cups as well, so this is what I'm going to be mixing the liquid into, I would write on each one of these cups what medication I have in each cup and the milligrams. Okay, so this is the first one. Then we're going to go ahead and crush these ones. Aspirin right into this cup here. Make sure we have all of it out. There we go. And then our other one is our Lasix. Perfect. Okay, so those are our crushed ones. And then this is our capsule. Okay, so then first, I'm just gonna go ahead and draw up some water here. You wanna make sure it's room temperature. And I'm gonna be putting about 5 or so in each cup, just enough to dissolve my medication. Okay, and I'm just gonna go ahead and stir them around really well so we make sure everything is dissolved. Okay, and then I would be going to Joanne's room. Outside of her door, I would then again do my second check, checking to make sure with each cup that I have my aspirin, 81 milligrams, my 500 milligrams of acetaminophen, and my Lasix, which I have right here, which is my 20 milligrams. So then after I did that, then I would go to Joanne's room, do my hand hygiene, change my gloves again. I'd ask Joanne her name and date of birth, her allergies, her pain, and then we'd be able to administer her medications. So first you're just gonna draw up 30 to 60 milliliters of water. And you're just gonna flush the tube here first. So under your end. Okay, so now that that's been flushed, we're gonna do one medication at a time. So we'll do this one first. Okay, make sure we have all of our liquid. We'll go to the garbage. Okay, and then between each medication, you want to flush it with about 15 to 20 milliliters of water. And then we want to flush it again. So another 15 mils of water. We'll do our last medication here. Making sure we have all the liquid. And after that one, you'd want to flush it again with your 30 to 60 mils of water, just to clean out the tube, make sure that none of it got left. Okay, and then Joanne's medication would be administered. You'd make sure she was all set in her room there, and come back 30 minutes later to check on her. So now I'm back into my med room. I've taken off my gloves, did my hand hygiene, and then I'm just going to document. So I want to make sure I mark anything orally that she took in, anything output-wise. Go into my MAR here, so she had her aspirin. Making sure you mark off each one. These are her 8 a.m. meds. Making sure that I mark each one that I gave. I gave her Lasix. I did her Lovenox injection. I gave that in her stomach. Her Gevity is going right now at 40 mils an hour, and she was also flushed with sterile water. So now that my documentation was done, I would then clean up everything I needed to clean up, and that is it.